right, good afternoon, members. Nice to see the group that's here today, and appreciate that you're able to come for this which should be the last meeting of education policy. And I know maybe we have a special guest in the audience that it would that be all right to say hello?
Thank you. This is my daughter, my oldest of my twins. She's 11 and on spring break, so I thought I'd bring her to the Capitol. Thank you.
All right, well, I think that we've got a topic today that she'd be interested in, which is what could be more important than how many nurses that we have in our school building. So just a good thing to think about, and I think a good topic for today. So hope that this has been an enjoyable day and that educational and all of those things that we would want. So
Thank you.
thank you. All right, well, our first official order of business will be to approve the minutes from Wednesday, March 15th. And Representative Berg, have you had a moment to look at the minutes? And
Yeah.
did you make the motion?
Yes, Madam Chair, I have, and I so move.
Thank you. Any discussion of the minutes of March 15th? Yes, Representative Feist.
Thank you, Madam Chair. I don't know if these are, oh, wait, I don't know how to turn pages over and look at the back of them. Never mind.
All right, they are complete then. Thank you. Any other discussion? All right, seeing none, all in favor of approving the minutes, please say aye. Aye. Opposed? All right, well, we have the minutes approved for Wednesday, March 15th. All right. And then we do have one bill on the agenda today, and this is a bill that was heard in the Senate. And I think it's also related to work that we've done in a previous bill. All right, so Representative Berg, if you will please come forward. And this is House File 2037. And it's our intention to re-refer this bill to Education and Finance. All right, if you're settled in, Representative Berg, would you like to make the motion to bring House File 2037 before the committee?
Yes, Madam Chair, I'd like to bring House File 2037 before the committee.
All right, and I believe you do have an author's amendment, the A1 amendment. And we can move the A1 amendment, and maybe there can be you can have a brief discussion of what is in the A1 amendment for us. And would you like to move the A1 amendment?
Yes, I move the A1 amendment.
All right, the A1 amendment is before us, and Representative Berg, if you would speak to your amendment.
Yes, I believe the A1 amendment just talks about having a school nurse at MDE.
Okay, all right, thank you. Any discussion on the A1 amendment? Seeing none, all in favor, please say aye. Aye. Opposed? All right. The A1 amendment is adopted. And now, Representative Berg, please present your bill as amended.
Thank you, Madam Chair. So currently, we have over 2,200 school buildings in the state of Minnesota and fewer than 650 licensed school nurses serving our students at this time. House File 2037 seeks to update state law that was passed 37 years ago to better reflect our students' ever-growing health needs. This bill would require one licensed school nurse in every building with at least 500 students. Additionally, with the amendment, it would also keep an LSN licensed school nurse at MDE to help coordinate health policies and work directly with our districts and school nurses. Data has shown that having access to a medical professional not only keeps kids in school more, but also improves test scores. We currently have one nurse for every 1,400 students, and many of those nurses are having to visit multiple school sites a day. The number of students requiring daily medication or those with complex physical and mental diagnoses is only growing, and as parents send their kids to school, they want the peace of mind that their kids will have direct access to a nurse. So this bill requires schools with over 500 students to have a full-time LSN, requires an LSN position at MDE, allows smaller schools to work with other small schools, and allows small districts to work with MDE to provide a LSN. And so I have a couple of testifiers today I'd like to turn the time over to.
All right, thank you, Representative Berg. First up, I see Jolie Holland. If you can get settled in and introduce yourself again and proceed with your testimony.
Thank you, Madam Chair. My name is Jolie Holland. I'm a licensed school nurse and LSN, and I'm speaking on behalf of the School Nurse Organization in Minnesota, where I serve as the legislative chair. We thank Representatives Berg, Kim, and all the rest of the authors for House File 2037. The intent of this bill is that every student in Minnesota has access to a licensed school nurse. I had a long journey to get here today. My mother was my school nurse. She had over 5,000 students in many locations, and I went on to become a nurse and started working in ICU where I had 2 patients. She kept encouraging me to become a school nurse, but I thought that it was just Band-Aids and boo-boos. So I finally decided to become a school nurse and was a district school nurse. And when I started, I was incredulous and I was shocked. At one point, I had 16 schools and 11 locations. And the level of the student health needs is overwhelming. And over my last 17 years, it's only become worse. Licensed school nurses are registered nurses that have a bachelor's degree, and they also are certified with a public health certification, and they're licensed through PELSB. The current law, enacted in 1986, only requires a licensed school nurse if you have 1,000 students or more. That means if you have 999 students, you don't have to have any medical oversight of your students. And if you have 39,000 students, you still only need 1 licensed school nurse. The old law is woefully antiquated. And now the survival rates for 24-week-old preemies is over 60%. And they're coming into the schools and they have significant complex health problems. The American Academy of Pediatrics recommends a professional nurse in every school. On the surface, this seems expensive. However, LSNs care for students who don't have routine health care. 2 studies found that over 30% of a licensed school nurse's day is dealing with mental health issues, and that was before COVID. I can tell you that sometimes it's over 50%. We are the front line. We have our open doors, no matter the time of day. And when students have stomach aches, headaches, chronic fatigue, chronic absenteeism, class avoidance, these are often precursors of mental health issues, and we can step in and help. Many students today are on multiple psychoactive medications for ADHD, insomnia, depression, and mood disorders. And that has intensified the need to look at the medical side of mental health. I have found many students where they are having serious side effects from medications, and so I work with the parents, the healthcare providers, and mental health staff to get them the help that they need. The 2020 U.S. Census said that over 5% of our U.S. children have no insurance. So sometimes school nurses are the sole provider of health in the educational setting, and that enables access to health care, which makes the role of the school nurse today even more critical. I urge you to pass this monumental bill. Mayo Clinic is known throughout the world for its excellence in health care. Let's make Minnesota schools be known for its excellence in student health care, and now is the perfect time to act. Thank you.
Thank you. I have on my list 2 remote testifiers, if that works with you, Representative Berg. First up is Angela Becker. Angela, if you can hear us, please unmute yourself, identify yourself again for the records, and please proceed.
Madam Chair, my name is Angie Becker, and I am a licensed school nurse speaking on behalf of the School Nurse Organization of Minnesota as a current member. We would like to thank Representative Berg and Senator Bolden for the One School, One Nurse bill as amended, which would recognize the critical role of licensed school nurses in education. I currently serve 2 elementary buildings and an early childhood program with a combined student population of 1,200 students. I have been a school nurse for 14 years and a pediatric nurse at Children's Hospital for 20 years. Today, I'm here to urge you as policymakers to revisit this bill that was written 37 years ago. Healthcare is changing rapidly, and school health offices look dramatically different than when this bill was written. As the number of students with chronic conditions grows, the needs for healthcare at school has increased. In one of my assigned elementary buildings, over 30 medications are administered every school day. We see an average of 60 students in the health office alone. Between my two buildings, I have 5 students with feeding tubes and complex health needs. School health offices are no longer first aid stations and are predominantly caring for children with chronic diseases such as attention deficit hyperactivity disorder, diabetes, life-threatening allergies, asthma, seizures, and a growing population of children with behavioral health concerns. Caring for children with chronic conditions in schools requires the knowledge of a licensed school nurse who understands both the health and the education setting. The presence of coordinated school health programs led by school nurses is linked to academic achievement, improved attendance, and better graduation rates. While the number of kids and programs that I serve is overwhelming, I can't imagine what it is like for students and staff and parents in school districts where there is no licensed school nurse. Who is reading the notes parents send thinking there is a school nurse in the health office? Is it the teacher? Is it the assistant, the secretary? Who is providing the health assessments for IEPs and special education evaluations? And who is doing the training for the students with special health needs, such as feeding tubes, urinary catheterizations, insulin pumps, continuous glucose sensors? As a pediatric nurse, I have cared for multiple children newly diagnosed with diabetes in the hospital. The number one parent concern after diagnosis is who will care for their child. It should not matter the size of the school district, the zip code, or the wealth of the district. All students in Minnesota should have access to a professional school nurse every day. We ask that you change this old law to make it fit with the medical needs of students across the state. Thank you.
Thank you. Thank you for your testimony. Thanks for the work that you do, too. All right, Annie Lumber-Benson.
Hi, thank you. Madam Chair, my name is Annie Lumbar-Benson, and I'm a licensed school nurse speaking on behalf of the School Nurse Organization of Minnesota, where I serve as the treasurer. I've been a school nurse for over 25 years now, working in a variety of settings, including inner city, urban, suburban, private, and public. The National Association of School Nurses also supports the position that all students should have access to school nursing care by a registered professional school nurse all day, every day. Additionally, the American Academy of Pediatrics has stressed the urgency in allocating sufficient funding to support this goal. You've already heard compelling testimony from my peers as to why this bill is so important, so I'd just like to add a few thoughts. Over the past century, the role of the school nurse has expanded to include critical components such as surveillance, chronic disease management, emergency preparedness, behavioral health assessment, ongoing health education, extensive case management, and much more. If a school nurse isn't present to do this, who's taking care of these important pieces? As I indicated, I've worked in a variety of school settings, and in those years, it became abundantly clear that need and disparity don't care about what city or town you live in or what your zip code is. There is need across the state, and all students should have access to a school nurse. I could tell you stories about the many Mondays I came into work with a lineup of kids waiting for me. These were students who had either injured themselves or gotten sick over the weekend, and their parent instructed them to have the nurse check it out on Monday. This is not because the parents didn't take them seriously or because they didn't care, but it was often because circumstances prevented them from getting the care they needed over the weekend. Parents had jobs that they couldn't take time off from. They didn't have insurance. They might not have a primary care provider. The reasons were many, but the end result was the same. Students and families depended on me as their school nurse to help guide and support them. For students who face barriers to accessing healthcare, regardless of the reason, but especially those living in predominantly low-income, rural, and minority communities, a school nurse may serve as their only regular healthcare provider, which is critical for health promotion, disease prevention, health maintenance, and health equity. This is not unusual. And again, I go back to the very real concern that what schools don't have a school nurse who is providing this care. And that's just one piece of a complicated puzzle. School nurses have the unique opportunity to provide prevention, intervention, and education as students are a captive audience. And prevention is the only way to make a difference in reducing our medical costs. We're able to offer education around that student's particular health needs, which empowers them to become experts in their own health. School nurses empower students to be well. We teach, treat, counsel, and support students to increase classroom seat time and decrease trips to the health office and absences from school. And then there's the issue that can't be overlooked. The last 2 years have had significant and serious consequences for the mental health of all of our students, which nurses have an important role in supporting. While most people know school nurses address physical health, the school nurse is really the front line for mental health too. Students often present with early somatic symptoms of stomach aches, headaches, and fatigue. School nurses assist in sorting out physical illnesses from a mental health concern, like anxiety. So investing in school nursing to identify students early with mental health concerns is an important component in addressing overall student health and truly needed as we come out of the global pandemic with all the complexities that have resulted from it. School nurses are key members of the education team and leaders of school health who keep students healthy, safe, and ready to learn. Please support this legislation to ensure that all schools have this integral team member to guarantee the needs of students are met. Thank you.
Thank you for your testimony, and also thank you for your work. All right, Kathy Schultz.
Madam Chair, my name is Kathy Schultz, and I'm speaking on behalf of the School Nurse Organization of Minnesota. I currently serve as the National Association of School Nurses Director in Minnesota. I'm on the SNOME Executive Board, and I've been a school nurse for over 20 years. I would like to thank Rep. Berg, the One School, One Nurse bill as amended, which would recognize the critical role of licensed school nurse in providing students access to quality care so that they are healthy, safe, and ready to learn. For approximately 6 years, there was no licensed school nurse at Minnesota Department of Education. To address students' health from the statewide perspective, give guidance, and disseminate critical communication to schools, and to inform MDE on the State of Health Services Office in Minnesota. SNOME was able to advocate for federal funding through the CARES Act to fund a position through October 2024. However, this state leadership position requires ongoing funding from the Minnesota legislature and should be a permanent position. This position is critical because it supports superintendents, principals, LSNs, RNs, LPNs, and non-licensed staff across all school buildings in the state. This position is the only expert at MDE that can speak about medical concerns in schools. It helps bridge the gap between education and medical settings. During the COVID-19 pandemic, MDE did not have the LSN expert in place to help provide supporting bridging the gap between the education and medical settings. This led to confusion, delay in action among LSNs, RNs, LPNs, principals, and superintendents. It would have been helpful to have public health concerns across the state to have someone at MDE coordinate with MDH and other agencies to coordinate school-based health-related services for students. There is no government agency that gathers school health data. An LSN at MDE would facilitate gathering data across the state. We have 2,122 school buildings. It is estimated there are 600 school nurses in Minnesota. We know this because of how many teacher-nurse licenses are issued. We have no accurate data at school on school nurses at each school or how much of the day they are at a site. We also have no data on how many anaphylaxis, asthma rescues, seizure management, or mental health interventions have occurred by school nurses. Data is critical to being able to offer safe, adequate care to our students. This school nurse at MDE would gather the data for the stakeholders, make sound decisions. One school nurse in one building can also help gather data for the state. Please feel free to contact me if you have any questions about this critical need. Thank you.
Thank you. And I think that's what we have for testifiers right now. And thank you, testifiers, too, for, you know, the great discussion that, and information that you provided us right now. Thank you, and very much for your work. Thank you. All right, member questions and discussion. Okay, Representative Berg.
Thank you, Madam Chair. Thank you, Representative Berg, for the bill. I think it would be great to have a nurse in every building. My only question is what happens when a building or a school district can't find someone to fill the position? We've been in that position in our district multiple times, so we have one LSN and then different people working. So how does that work in this bill?
Representative Berg.
Thank you, Madam Chair, and thank you, Representative Berg, for the question. It's my understanding that there are some programs out there that are working with the community and kiddos that are going off to college to sort of bring them into the profession, as well as, and I don't know that this would apply to your area because you have fairly large schools, but for example, if there are schools in rural Minnesota and one of the schools has 500 students and the other school has 500 students, they can work together to have one school nurse. What we can't do is start grabbing from all sorts of different schools to try to come to the number that's suggested. I'll let my testifiers answer if they know a little bit more.
Ms. Holland?
Thank you, Chair. The other thing is a lot of nurses have left the school nursing profession. I work with the Wright County and McLeod County nurses, and I've seen probably 8 nurses that have left because the workload was so intense, they just felt like they could not handle it anymore. And so they left. I just lost one that went to a private sector. I think we could call those nurses back. And there's, and one of the nurses that we hired in our district was at a hospital. And when she came, I got her to come in part-time. And once she saw the need, now she is full-time at our school. And she loves it. So I think we could pull a lot of nurses back if we can change this incredible ratio that we have right now.
Follow up? Okay. And I know part of the question is, we're setting out this goal. Is it a goal, or is there a mechanism if a school district or a district's not being able to meet that? Is there anything in the bill that addresses that situation?
Yes, thank you, Madam Chair. I didn't have the particular section in front of me when I answered that, so I tried to wing it, which was clearly not great. So part of this bill does include the school nurse recruitment grants, which creates a grant program at the MDE to increase partnerships between school districts and colleges to train and certify school nurses to better serve rural and lower income school districts and provide opportunities for more diversity in school health offices. And I also wanted to add that I think when we put the element of the data reporting that we want to do that currently we are unable to do because of the need for staff to do that, I think that might make a change too, because school districts will begin to really hone in on the need, and especially if these grant programs bring in more students that want to become school nurses. So there might be some, time in between we're able to implement and have people come back into the field or call nurses back, especially if they feel like they have some support where, again, it's not one school nurse to 1,200 kids.
Thank you, Representative Berg. And we do have one of our remote testifiers too, has a response. Ms. Becker.
Yes, thank you. I just wanted to add that as an organization, we're committed to our Grow Your Own program is what we're calling it. We have many people who start out in the position as health paras and don't have the education or certification that they need to become that professional school nurse. And so we're committed to utilizing and helping to support those students who want to move on and continue their nursing career to be able to do that, which would then help fill the void with those school nurse positions.
Thank you. Representative Feist.
Thank you, Madam Chair. Thank you so much for bringing this bill. I am working on a bill that in some ways parallels this with registered nurses to attract nurses back to the bedside. And one of the key issues that they talk about is the same here, that if you are spread so thin that you don't feel like you're able to give that individualized attention to your kids, in this case, and patients, in their case, then there is like just this level of burnout. So this bill, like my bill, has both the element of, my bill is not a ratio bill. We like to make that clear. This is a ratio bill, which is cool. But it has that extra element, in addition to your ratios, of trying to recruit people to the profession and bring them in. And I think that, like, taken as a whole, it's just a really elegant bill, and I just strongly support it. Thank you.
Representative Bennett.
Thanks, Madam Chair. And I'm just wondering, what are the differences in the qualifications between registered nurses like LPNs, RNs, who work in nursing homes, hospitals, and so on, compared to a licensed school nurse?
Right, Ms. Holland.
A licensed school nurse is a bachelor's degree nurse, and there's RNs that are 2-year programs, and there's some, I think, still 3-year programs, so you can have different levels. But what we're hoping is that we can pull more nurses in to get their 4-year degrees, and then they register with the Minnesota Department of Education and have their public health certificate, and they become licensed school nurses. And then they bridge that gap between education and health.
Madam
Representative
Chair.
Bennett.
Thank you, Madam Chair, and thanks for putting up with questions, because I totally have no background in this. So would it be equal to an LPN education level? I'm not sure how many years it takes to be an LPN versus an RN. If you could kind of.
Thank you, Madam Chair. Usually LPNs are 1-year programs, and legally they can collect data, but they can't make nursing diagnoses. And usually they work with an RN, under an RN supervision, or a licensed school nurse supervision. So they can work with the patient bedside and like I say, collect data. But as far as taking that data and making a nursing assessment, they don't do that.
Thanks, Madam Chair. One more if I could.
Yes,
So just to
Representative
clarify, this is maybe more equivalent to an RN in education level. Is that
Correct.
correct? Okay, thank you.
And Representative Berg.
Thank you, Madam Chair. Also, in your handout here in the packet, it does say that licensed school nurses are registered nurses with a bachelor's degree or higher who hold public health certification and licensure through PELSB. So that's also a little bit more of the difference that we're speaking about in public sector nursing.
And Representative Berg and testifiers, if you can indulge me too in my questioning. I know often in the medical field, there are people that work under supervision of someone with a higher level of qualification, but that they are the person that, there could be somebody on site. So does this bill speak to that at all? That if there was a district that had people in buildings, but then someone with that higher level of, that could do a diagnosis, for instance, that, but somebody else could, provide other services, is that kind of contemplated at all, or is that part of this? And Ms. Holland, you're nodding for me.
Thank you, Chair. Yes, we would still be able to have people that would man the health offices, but they would have a closer relationship with a licensed school nurse. Right now, we've got schools where it might be a secretary, it might be somebody that's got first aid, CPR training, no other training, and they're taking the medical notes and they're giving medications, and they don't know what they don't know. And I've seen it multiple times in different schools. So the difference is with a licensed school nurse, I have health assistants myself that are first aid CPR trained, but they know when to call me, they know when something is critical, and then I can be there and I can be aiding things so they can man the offices too.
Thank you. All right.
And Madam Chair, I think
Yes,
that's a
Representative
little
Berg.
bit, I'm sorry, I think that's a little bit why we want the position at MDE as well, just so they can sort of be a resource and set some guidelines. So when you've got someone that out of need, or as it says here, maybe the school district contracts out with an RN, which is not the same as licensed school nurse, but it's somebody in the building, and then a registered school nurse could come in and do the heavy lifting, so to speak.
Yes.
And Ms. Schultz?
With the public health piece, you're able to maneuver the resources for the student. So when you have students in a building that have quite significant needs, they may be able to do the basic things, but to get them the services and to get them the healthcare and to be able to assess them, that's the difference. We can assess a situation. You would need an LSN.
Right, seeing no more member questions or discussions, again, our thanks for everyone for being here and for bringing this bill forward. We're happy that we were able to hear it in policy and be able to ask these kinds of questions before advancing it to Ed's Finance. And that is our motion at this point. So I will renew the motion of Representative Berg to re-refer House File 2037 as amended to the Education Finance Committee. All in favor, please say aye.
Madam Chair, could I do closing remarks?
I'm so sorry. Representative Berg, your
Thank you.
closing remarks, and then we'll get back to the motion.
Thank you so much. This bill goes a little bit hand in hand with my HF8, which requires school mental health personnel in every school across the state full-time. That does include school nurses. I know from conversations I've had that school nurses also provide things like teaching kiddos how to regulate their emotions, teaching kids about hygiene. Some things are very basic and some things are very complex. I've been working together with SNOM we did it last session, so now we're back for a second swing at this. And this again comes down to removing barriers for our students to be able to learn. So when they have care available that they may not be getting outside of school, just like when they don't have food available when they're outside of the school. We're removing barriers, we're talking about equity, we're having folks that are fully licensed that can address the different complex issues. Some are cultural and some are extremely complicated medical. You know, I admit I'm embarrassed as a parent when my youngest son was in school, and I had asked him one day about something that happened to him, and did he go to the school nurse? He's like, well, we don't have one in our school. And I was appalled, and I just expected that they did. So as a parent, admittedly, I didn't even know that there wasn't a school nurse in my son's school. And so this serves to rectify that for all the parents, all of our students, so that we can make sure every student in Minnesota has the capacity to thrive and learn. Thank you.
Thank you, Representative Berg. And with that, we will re-renew the motion to re-refer House File 2037 as amended to Education Finance. All in favor, please say aye. Aye. Opposed? All right. Motion carries, and you make it to Finance. All right. Well, that is the only bill that we have up today, but we're glad that those of you that made it today are here. And that we were able to move one more bill over to Education Finance. And I just wanted to just briefly, again, say thanks for the committee members, all of you, for participating in that. Vice Chair Hill, thank you for your work. Lead Bennett, thank you for your work. And we want to give a special call out to our nonpartisan staff, which we know the quality of their work is unsurpassed. Cassandra McGinnis, that we don't see in committee, she's not sitting at the table, but where would we be without the work that she does in the revisor's office? And then, of course, Christine Para and Tim Strom, you are invaluable and just the most important members of this work right now. I also have to thank the staff that supports me and I know supports you, our researchers, Mr. Withers, Mr. Mars Beltrandi-Runquist, and then, of course, our committee administrator that I know that everybody's had to work with right now, Wilson Lee, thank you for stepping up and taking on this responsibility without a lot of notice ahead of time to prepare for it, but really, really appreciate all your work. And of course, Isabel Anderson, that has also stepped up and has been perfect with those minutes every single time. And that's actually a very valuable part of all of this and all of the work that it takes to get our packets together. So that's it for us, folks. It's been a good committee, and we actually have another year. And we're hoping to hear a lot more bills next year too, and really maybe get to some new topics that we were not able to get to this time, because we were picking up a lot of things that were hanging over for a while. Oh, and I almost forgot, I made a special point. I know that we depend on our pages and for technical assistance, for making sure that everybody, all of our testifiers, we get the correct information for them. So Nick Khaled, thank you very much, and I know that's been another team of people that have worked with us too. Thanks for the work that you did too. Thanks for the reminder of that, Wilson. All right, so with that, our meeting is adjourned.